Today is a really exciting day because it marks the first day of a 2-week block of pediatric emergency medicine. We're currently on our 6-week block of pediatrics for a clerkship. And what I've done so far is 2 weeks of pediatric internal medicine, or as we call it, the pediatric CTU, or clinical teaching unit. I also had the opportunity to do 2 weeks of pediatric infectious disease, which was a super cool and very, very unique experience. And now I'm shifting over to a 2-week block of pediatric emergency medicine. Right now I'm talking to you guys. It is 1 p.m. on December 30th, and it is day 1 of a 2-week block of pediatric emergency medicine. So in this 14 days, each one of the medical students get the opportunity to do 8 shifts. And today my shift will be from 5 p.m. to 1 a.m. the next day, December 31st. Right now it's 1:58 in the morning. Just got back, finished pediatric emerge shift number 1. So overall, I would say the shift was definitely filled with both wins and lessons. Coming into this first shift, honestly to say, I was relatively nervous, just kind of not sure exactly what to expect, considering we're using a different type of documentation software. These are patients that are presenting with different levels of acuity, undifferentiated diagnoses, working in a new environment. But reflecting on the overall experience, it was really fantastic. I was really, really lucky to be paired with a fantastic staff physician. He was extremely supportive, very knowledgeable, and very open to providing feedback, and also a really good teacher as well. So let's chat a little bit about what the flow in the peds emerge looks like. So you walk into the peds emerge, you get a computer. You're assigned. We basically have a medical students area for the different computers. So we each have one of our computers. I log into the computer. We can see all the patients that are waiting to be seen by a physician or a medical student or by a resident. And then essentially you just assign yourself a patient, go see the patient, then discuss with the staff physician, and then you'll go see them together. You'll discuss what the management plans are, what are the next steps, what investigations that you want to do, and then essentially just rinse and repeat. So today I was able to see a wide variety of different ages, ranging from 3 months all the way to 5 years. So more on the younger side today, actually. And presentations included increased work of breathing that was ultimately a viral respiratory illness in nature. I was able to see 2 different siblings that initially presented with vomiting and fever. That was, once again, most likely a viral gastritis. I was also able to see a younger individual with a history of cough, as well as fever and increased work of breathing that ended up being a lobar pneumonia that was discovered after chest x-ray. And then also I was able to see a toddler that presented with a history of cough, and then also some GI findings as well. So that wraps up day 1, and we'll see you on the next one. Okay, now we're just in the elevator heading to our second shift of pediatric emergency medicine for the week. It's currently 6:15 a.m. and I have a 7 a.m. till 3 p.m. shift today. These mornings are always the toughest too, because it's like -5 degrees Celsius outside and very snowy. So day 2 of pediatric emergency medicine was really, really good. I was able to see 7 patients in the span of 8 hours. So most, if not all, of the patients that I saw today came in with symptoms pertaining to a respiratory nature. A lot of cough, a lot of congestion, a lot of runny nose, some with fever, some without fever, some that have these symptoms for a few days, some for more than a few days. And then once again, I was able to see patients ranging from about 6 months and until I believe it was 12 years today. So once again, a pretty good range of different patients. So today compared to yesterday, a skill that I was already able to significantly improve of, something that I'm quite happy about, was the use of the otoscope. So yesterday I was chatting about how I wanted to improve looking into patients' ears, the ultimate ear exam, making sure that you can visualize the tympanic membrane. And I was able to successfully diagnose multiple otitis media or ear infections in a few different patients. And one of these patients was even less than 1 year old, which I was super happy about. So already we're on the uptrend, and things are going well. Things to kind of work on, continue to reflect on, do a little bit more reading on pneumonia, community-acquired pneumonia versus atypical pneumonia, continuing to work on, as I mentioned, the history and the physical, presenting the findings to the physicians. But ultimately, day number 2 was a success, and looking forward to day number 3. And a few things that I like about the peds emerge and just emergency medicine in general is that you never really know what's walking in the door. Also, a lot of the symptoms that we are seeing right now in the Canadian wintertime are respiratory tract in nature, but ultimately in pediatrics and in particular emergency medicine, you really do not ever know what's going to walk in the door. You won't really even know what the next case that you're going to be seeing is. So I definitely like the variety of the different types of cases, and I really appreciate the collegiality as well in the emergency department. Every single physician, nurse, medical student, resident are very kind and very supportive. We all really do truly care about the patients that we're serving, that we're caring for, and ultimately are working together to make these individuals feel better, go home with a plan of action, know that they've been listened to, that they've been heard. And then this is also just what makes our day better as well. So really looking forward to what day 3 is to bring and how we can continue to learn and continue to improve. It's a beautiful day outside, nice and chilly, but the birds are singing, the sun is shining, and we're on to day 3 of pediatric emergency medicine. So as always, very excited for what the day ahead is going to bring. So let's get into it. I've just got back home after finishing up the 3rd shift of pediatric emergency medicine. And honestly, I can say that with each and every shift, the days just continue to get better and better. I'm able to learn more and more each and every shift, feeling much more confident than day 1, which I'm super, super happy about. And today, once again, I was lucky enough to be paired with a wonderful preceptor. He was extremely good at providing feedback, a wonderful teacher, and also he gave me a lot of independence today, which I really appreciated. So once again, I was able to see many, many different patients on my own, go conduct the history, conduct the physical examination initially, then present these findings to my supervising physician, my preceptor, talk about an assessment, talk about a plan, what imaging that we want to do, what blood work that we want to do, what do I think is appropriate clinical management. And then, as previously, he would go see the patient, and then we would finalize our assessment and plan, and then go from there. But I would say that on day 3, I'm already feeling more confident in my history and my physical examination skills, and the material that I'm able to present to my supervising physician and my clinical findings, I'm feeling much more confident than I was on day 1. Today was really nice because I got to see a lot of different cases. So right now in Pediatric Emerge, we are seeing a lot of different respiratory conditions, a lot of viral upper respiratory tract infections, and then a lot of bacterial pneumonias. And it may just be that season. And this is actually something that we're seeing across Canada and the US. So we were able to diagnose a few patients with pneumonia today. There was also a few patients with cough, cold that was diagnosed as a viral upper respiratory tract infection. There were a few patients that were coming in after being previously treated for a pneumonia. And then I also had a wonderful opportunity to help reduce a fracture. So this was in an individual after suffering a wrist fracture after snowboarding. So there's something that we call a fouche, fallen on an outstretched hand, when essentially you fall and your hand is outstretched like this. And I was able to be in the room, witness the sedation, and then help actually like reduce the fracture by helping the physician as well, which was a super cool opportunity. And I was even planning to go snowboarding this weekend, so hopefully that doesn't happen. Things that I'm reflecting on and things that I want to continue to work on, just continuing to nail down my history and my physical, making sure that I am asking the right questions on his history, making sure that I'm able to successfully complete a physical exam and interpret the relevant findings, and continuing to work on as well a differential diagnosis, as I mentioned previously, which I think even today compared to day one, it's already getting better, which I am extremely happy about. And yeah, I think just as the days go on, confidence will build, skill set will build, things will just continue to be on the up. So I'm excited for tomorrow is day 4 and will be the last day of week 1 of pediatric emergency medicine. So we'll see how that day goes and what comes in the door. Today's my 4th shift of pediatric emergency medicine, and it's also the end of week 1 of peds ED. As I was mentioning throughout the week, I've been surrounded by a lot of coughs, colds, pneumonias, viral upper respiratory tract infections, the whole works really. And you may be able to hear now I have a little bit of nasal congestion, a little bit of a cough as well. So that's unfortunately just the risks of the trade, I suppose, even being masked and everything. But overall, feeling pretty well and excited for the day ahead. And with that, my first week of pediatric emergency medicine has wrapped up. A very common theme that I've been thinking about over the past few days, and even in this video, is that with each passing day, things get better and better. The skills feel more confident, the patient interactions feel more natural, and even the presentations to my attending physicians feel more natural and more polished. And throughout the course of my block, I've worked with wonderful other medical students, amazing residents, and also fantastic academic preceptors and the attending physicians as well. I've got to see a lot of different patient cases, patients ranging all the way from, I believe, 1 week old all the way until 17 years of age, and also a wide variety of different patient cases. I've been able to grow my own skill set, my own confidence, my own clinical approach to different patient cases. And it's really nice because each and every day you don't really know what to expect. So ultimately, just thinking about my overall summary, my overall reflections on pediatric emergency medicine, I really enjoyed it. I'm really looking forward to what the next week has to bring. Although next week we do have a written exam as well as an oral examination on top of our shifts that we're working in pediatric emergency medicine. So next week ahead is going to be very busy, but it's also going to be filled with excitement. So thank you for being with me on this journey through peds ED. It's been a really fun week. I'm super happy I've got to share even just a little bit of my experience with you guys. And please like, comment, subscribe, all of that good stuff. I really appreciate it. And I'm looking forward to the next video ahead.